We are have the opportunity to speak with Rahmeh from UAE. I'm going to turn it over to her, and she's going to introduce herself and tell us a little bit about where she is currently working.
Hello, it's my pleasure to meet you on video. I'm Rahmeh. I'm a social worker and child protection officer working in UAE since around 3 years ago. Um, I worked directly with the children from KGs until the high school. Like I supporting children from KG or pre-KG until the grade 12. We used to provide them with like awareness sessions about their rights, about how they can improve and how we can empower them. And we're focusing directly with the middle and high school level because they are preparing to go to a new stage in their life. So yeah, we used to focus on the empowerment of the children, of the students. Um, yeah, we for the KGs and primary grades, we used to like to build the trust with them. We used to work on advocacy program, like to let them know that they have someone who can always listen to them, someone who can always support them without judgment. And yeah, so we're working mainly on two programs, the advocacy and the empowerment.
Okay.
Yeah, and also,
Yep.
I'm sorry to add this. Also, for the separated and unaccompanied students, we used to do like a case manager, a study case, and a care plan for them, like a short care plan, and to follow up with them directly. And to be honest, here, we're always reported to the protection unit and the Ministry of Education. We have like a protection unit, especially for the schools, and we direct contact them if there is any like a protection case, and they provide us with the needed support on spot.
Okay. Thank you. And um, can you tell us now about what is the system in place in the UAE that for instance is this a governmental initiative? Are there laws around child protection? What governs the work that child protection workers do in the UAE? And how does it function there? How do you get to hear, how do you hear about children in need? How does it make it to you, the information?
Okay. Yeah, here in UAE, they established the child's law in 2016, and they named it Wadima's law. It's about a child who someone who abused that child, Wadima, and there is a story regarding to that name, and they started to let all people aware about it, all schools, all organizations, and even the play areas for the kids, like any park you will find in the winter season, initiatives for the children. In every park, they say here and winter we have a very good weather, so we used to go to the parks and to spend more time with the children. So in each place you will find like they are doing initiatives for the children, even competitions, even safe play area, even to let the children draw on their faces or painting, drawing, whatever it was. But it's helped the children to feel like comfortable, to feel safe, um, to just let their feelings go out with the activities. And to be honest, they are focusing in the school, and they are focusing on the social workers here who's working with the children to like to receive a regular trainings, to receive a regular workshop, just to to improve their knowledge and their experience, to let them fit enough for that position. And yeah, they always support the children here, and they are working on it, you know. They're not they saw that it's good, Wadima's law, it's a good law for the children. It's prevent and protect the children, but they did not stop. They always like update their policies regarding the children's. They give the chances for the like experienced people to go more with the international policies and rules. And yeah, here in all Emirates, to be honest. I'm working in Sharjah especially. Yeah, but the governmental organizations, it's all for the whole 7 Emirates. So they covered the 7 Emirates with the updated child protection laws.
Okay. So maybe I should have I should have asked you earlier. So those who might not be familiar with what UAE stands for, so it stands for United Arab Emirates. Can you tell us how it functions? You said there's seven. Can you tell maybe the audience who are not familiar how it functions? Because you're saying Wadima's law is for all seven, correct?
Yeah.
Okay. Tell us a little bit about what the UAE, how it's all comes together.
Okay. To be honest, here they believe in law, and everyone, even the residents or the local UAE people who live here, they believe that every law or every mission they should follow it, because it's for the best interest of the UAE future, you know. So Wadima's law, it's not a law who can you cannot feel that it's like a weird law, or it cannot be suitable here, or we cannot follow with this rules. Never. It's like around the basic needs of the child, which it's their education, health, and mentally, and others, right? So it's called about the basic needs of the children, and then how we can support them, even the parents, the caregivers, the school, and how we can protect them. Like it's the law, it's all about the prevention steps to protect the children in the future. And if there is any abuse on it, on the child, how we can work with them and how we can support them, even if the workers or the governmental organizations. So to be honest, it's not difficult to follow that law, and it's not difficult to work with it. And they are aware enough, because they did not establish the law just like this. You take we established that law, you know. It was like a plan, and they let the people aware about the child and about the child law before they established the Wadima's law.
Okay, excellent. Thank you. And please tell us about how someone hears about. So how do you get referrals? How do you hear about a child that might be abused? How does that happen? And then if you get the call,
Mhm.
what's the process? And how do you engage with the family? What's the process from beginning to end?
Okay, we and you know we are not in child protection agency. We are in a school. So once we received or noticed any abuse on the child, we need to do like a mandatory report to the child protection unit and the Ministry of Education. We call it in charge as SPIA, but in all Emirates the same. As a social worker, I can receive the referral from the homeroom teacher or the assistant or the section supervisor. These three can report to me any case, or they can refer it to me. And then I do initial assessment with the child, and I refer all children to the main clinic for in the school. And then I receive a medical report from the main clinic. We used to do like a case study. We used to contact with the parents if there is nothing, like as there is no something mandatory or something like put the child on a risk, in a risk. Otherwise, if there is something emergency, we do the mandatory reporting direct to the child protection unit and the Ministry of Education, and they do the procedures. In our school, if there is no that much risk, we do our case assessment, and we do our care plan, and then we contact with the parents. We work on a care plan for the best interest of the children, and we follow up directly with the parent, and that's it. Yeah.
Okay, so what I'm hearing you explain now is um, if it's serious, and then if it'll be helpful to understand from you what are the serious ones that you refer to the protection unit you said within the government versus cases that you handle. So
Okay.
how do you determine?
Okay. So if one of my cases came to me, or let's say a boy in grade 4, I just visited their class, and I just noticed marks on his face. I directly take the child, refer him to the main clinic and the school, and then I received a report from them. At that time, I was sitting with the child. I was doing my own assessment, like with who you're living, who's your close one in your family, how you spend the time, how if you are feeling angry, how you can release your stress, and that question from that questions. And then we contacted the parent to let them know that we found 1, 2, 3, 4 on your child's face. And of course, there's some reasons. If it's logic, we will put that child under observation. And if it's happened for one time, we are focusing on the repeated cases, if it's happened for one time, and he's just say that I was playing with my brother and then we fell down, it's fine. We understand that, but it doesn't mean we will forget it or we will ignore it. We keep follow up with that child like minimum for around 1 month in the school. 1 month, it's good enough to understand that. And sorry, just 1 minute. Yeah. We were talking about the how if it's repeated the cases or no. If we found that child came to our school and we found some marks on his body or face or hands like this, like 2 or 3 times, and then we need to do the mandatory report. And even if we found a mark with someone who slapped him, not like someone who used the cigarette with the body, or someone who used like a knife or something like that, there is a level of the severity of the case or of the abuse, and depends on that we do the mandatory report, or we keep it until the child protection committee in the school.
Okay. In the mandatory report for the, it sounds that you make mandatory reports on cases that are quite serious. It goes, you said, to the unit. Who are the individuals who work in that unit? Is it other social workers or police?
Both sides.
Okay.
both sides, especially as for governmental, like it's an governmental agency. So you will find the social workers, and you will find the community police station on it. So they collaborate with each other. But the focus on the social worker, how they can do the case study and how they can work directly with the child.
Okay. So I'm hearing you what you're explaining is in the UAE, which is it's done a bit differently than here in Canada or the UK or the US, is that there are almost two stages where child
Yeah.
protection is done. There is the stage where you're at, where if it's deemed not extreme or too serious, you work with the children and families.
Yeah.
But if it's deemed serious and extreme, it goes to another level. Is that correct?
Yes.
Okay.
Yes.
Okay.
And
Uh,
even,
yeah.
sorry, just to clarification at some point, even when we refer that, like when we refer it to the protection unit, they never take like a serious action with the parents directly. They
Oh,
do their, oh yeah, of course they do. They their own assessment. They visit the child. They ask the child to talk with. They understand the background of what's happened with that child. They always looking for the family. Like, we need to fix it. We need to improve it. We need to make sure that the total of family members are going as they should
mm,
be,
mm,
so they giving the social workers like a very big part to let them work directly with the child before they take any action from the community police,
I see.
you know
I see.
yeah.
Okay. Okay. Um, so that now explains and it establishes for us um how protection is done in the UAE. It gives us a better understanding right now. And you said referrals might come from in your situation, it comes from you observing directly or a teacher in the school because you're a school-based uh,
Yeah.
protection worker. Okay. So are there other ways or methods? Can people phone if it's not in school? Do people phone? Is there a number that they phone if they want to make a referral or in directly as well?
Yes, of course. Yeah. For the child protection unit, of course, we have a hotline here,
Okay.
and it's shared with everyone. You will see the posters on every street, that hotline for the child protection. So anyone who can see any abuse on any child, they just will call the hotline, and they will report it directly to the child protection unit without mention their names. No need to mention their names.
Anonymously. I see.
Yeah.
Okay. Okay. Thank you. Um, so in your capacity, working um with children, you're still working with children who might experience abuse. What are the for you the challenges of that job that um, you've experienced? What would you say those challenges are?
Oh, um, okay. As Rahma, to be honest, I always like to do more for the child. Like, I have a role. I have that job to do it. Sometimes would like to continue supporting that child, or to do more for them. But my job say that your limit until here, and then it should be go to more specialized workers. That's why this is one of the biggest challenges I faced. And I can say that you cannot make sure that all parents are aware enough, or understanding the main role of the social worker. Some of the parents, they okay, we understand that we need to give our children their rights, but I cannot understand that someone can sit with my child and ask them about their routine and the daily paces, you know. Yeah.
Okay. Maybe if you can tell us more about how you manage that. So some of the challenges you're mentioning it's the parents who might say to you, how come you're talking to my child without me knowing, or I didn't give you permission? Um, do pay do is it's Wadima's law, right?
Yeah.
Does Wadima's law state that parents, is this voluntary, or they could tell you, you know what, you can't talk to my child? How do you
While
yeah,
okay. While I am the social worker and child protection officer in the school, I have the right 100% to talk with the children.
okay,
Yeah. On the other hand, to do not make like any confused between our school and the parents, you will find like a child protection committee in the school. It contains the child protection officer, the nurse, the principal, the head of administration. We're a committee. If I faced any challenge with the parents, like how Ms. Rahmeh can talk with my children, there is another colleague who can support me in that situation. There is another colleague who can discuss more with the parents. We cannot face everyone like alone. We're working as a team, you know.
okay,
And once we're working as a team, so there is more than a person who can deal or handle the case.
I
It
see.
doesn't mean that they know everything in the case study. They should not know it. Only the child protection officer who can go deeply with the child about any type of abuse or the whole story. The other committee members, they know hit points.
Hmm.
Yeah. And if I have like that child protection case, I need to do the mandatory report. So me and the one who I reported the case to and the child protection unit, we are fully understand the case.
Okay. So you keep confidentiality. You're saying there's confidentiality.
First, that's the baseline of our work, you know?
Yeah, yeah.
Yes.
Okay.
I'm saying.
No worries. So, one quickly point of clarification. So there is a child protection social worker in every school in UAE that does your job? Or
Uh,
do you cover several schools?
Now they are working to cover all schools. Like what I'm sure about it that we in Sharjah, every school they have like a one child protection officer.
Okay. And Sharjah is a province or a city?
A city.
A city. Okay. Um, and okay, so in Sharjah, you're saying all the schools have someone like you who works in that school.
Yeah, because I'm working in Sharjah, but what I know that um, it's happened in Sharjah, it must be happened in Dubai and Abu Dhabi. And they are working to improve that thing. As I told you, that it's a new law since only 2016. So
Right.
they are working on that. Yeah.
Okay. So what got you, like, how did you end up in this role? What inspired you, or what why this role in particular for you?
Um, because of the cases I dealt with that before, maybe. Because I love the kids. I used to love the kids. I used to spend times with kids, and I'm interested to let them live like a better life of our life. You know, when we were kids, our parents they weren't aware enough about how to deal with us, how to support us, how to listen us, and I feel I need to give that right to every child that يعني, feel safe. There's someone here who can always support you. Feel comfortable to share anything you happened with you without to feel shy or without to feel scary or without thinking that there is someone who can judge me. You know that? Yeah, I think that that's the main reason.
Okay. And so if you thought about what you do every day, what do you love most about this job?
Um, when my students saw me like I'm walking in any corridor or I'm talking with anyone in the main reception or the playground, they always run to hug me, Miss Rahmeh, Miss Rahmeh. They always feel like this is the comfortable person for us. This is the one who can always refer to, you know?
Yeah. Okay.
Yeah,
Um,
yeah.
what So you talked about cases. You mentioned, I don't know if it's a case you had, but a situation of a 4-year-old with bruises. What are the variety or types of cases that you see or you work with that you, on average, maybe that you end up working with? What are the types of abuses and cases?
Here in UAE, um, children have too much time without with doing nothing. They have everything they want. They have the nannies, they have the parents who are working always or who are busy. They spend the time with the nannies. They spend the time with devices. So the child I saw many children who are looking to someone who just to take their attention, you know.
So so what are the like in the school?
Yes. Yeah.
Yeah, what are the types of cases that you see that what are the types of cases or abuses that you see that you get involved in?
Like neglect,
And
anger issue,
okay,
um uh, like um separated children with the reflection of separation,
oh, okay,
um anger issue, neglect, separation, yeah, like these
like
cases.
that. And so
Mhm.
in your context, neglect.
Mm.
What is neglect in the UAE that if you can define it or explain or give us a an idea of what that case looks like?
Yeah. Okay. We used to tell the homeroom teacher or the assistant during the child safeguarding training that if you noticed that that child every day came with like a junk food in his lunch bag, there is a big question mark.
Okay,
If you found that that child has like a long nails, there is a big question mark. If you found that that child came with like a dirty on his uniform last week and this week, there is a question mark. So all these cases refer to us, you know, and we the main cases. Uh, I think the junk food and the junk food mainly.
okay. And so you in your case management, do you also meet with parents in the homes? Do you go to their homes?
No, there is no home visits here.
No. Oh,
No.
nobody does home visits.
Of course, the child protection unit. But
that unit.
for the social workers who are working, who are working in schools, no, they are not allowed to visit, to do home
Oh, okay.
visits.
Okay, so the parents will come to the school to meet with you.
Exactly, yeah.
Okay. And the families and cases you work with, and you said you work in a team. Um, I think you mentioned you have 30 days, or how many days do you work the case? How long do you have?
It depends on the severities. Like we started with 1 month until 1 month until 3 months, like 90 days.
Okay. Oh, okay.
Yeah.
So the most you can get involved is 90 days. That's the most?
To be honest, it's not the most because this is the like the severity cases we have.
Oh, okay.
Like if we are dealing already with mild and light and mild, like mild and moderate like cases.
Yes.
So we're not dealing with the severe cases.
Okay.
You
Oh,
know, yeah, we're working the care plan for us. It will be from month to 3 months. It depends on the success or the achieving of our goals. If we achieve it, then perfect. We will follow up with the case.
mm,
If we are not, then we need to change the care plan or to update it.
okay. And what are the steps or processes that you include in a care plan that and you work with the family? What is it that you ask them to do?
Okay. As the case is needed, we contact the parents like directly, and we meet them directly when we are working on a care plan for their child. So like if one of our children, we found that his mother used to beat him. Not that much beating, but she's doing that. So when we meet the parent at that stage, we ask her to tell us the reason about that act, and depends on the reason. We ask her that we have like 1, 2, 3, 4 goals, and we need you to work on the reasons which made you beat your son, and how you can control yourself. To be honest, sometimes we're working as a social worker for the parents also, not only the kids, because we cannot ask them to do something and like they are not aware to how to do it, or they are not ready to do it, or they are they don't know how to like to find some other solutions than beating their kids, you know.
Okay. And the
Yeah.
goals that you set, are you helping the parents directly work with them? Do you sit with them and do sessions, or you refer them to other services that will help them do that?
For the sessions, no, we refer them to other agencies. But like regular meeting, parents meeting, yeah, we do it in the school. But we're not the social workers who can give the parents the sessions while we're working in a close community like such as the school. So we provide the children with the sessions, individual sessions or a group work, but for the parents, we used to refer them if needed. If not, while we're sitting with them and staff or social worker parents meeting, we used to like, we cannot say it's session, but deeply it's a session, to be honest.
Okay.
Yeah.
And then if you did send them to outside sessions,
Yeah.
you then wait for a report. Is that what happens?
For the report,
You wait. So if you send them to a session, look, what kind
yeah.
of sessions do you send parents to? Let's start.
Like it depends on their needs. Like some parents, they need the um, a medical intervention. So we send them for the governmental hospital. If they need for like family supporting, we send them to that agency. It depends on their needs.
Okay.
But after that, we're not waiting any reports from outside Asian agencies.
Oh, okay. Okay.
Yeah.
S-
We are waiting the results, you know. What we are caring about is the result. Once they stopped abuse their children, this is what we need. We are not caring about the reports or the type of sessions they are receiving outside. We're just caring about the results on the child.
Okay. And so how do you know that the results are good, that they've stopped? How do you
We
determine that?
we noticed that, like, we used to do more than one or two tour daily for the whole class, school classes. We have the homeroom teacher that she noticed that because, or
Uh,
he noticed that because, we have the advocacy or awareness session weekly for the
okay.
classes. So the homeroom teacher used to talk with the children, used to notice their feelings, used to observe their attitude and behaviors inside the class, and also the section supervisors. So we can notice that. We can notice by doing the behavior tracker.
Okay.
The social worker at section supervisors, we can do the behavioral tracker for the kids who we already working with them on the care plan.
Okay, I see. No, okay, I understand. Um, what what is it, if you have an opportunity right now to explain what do you think families or others in your community misunderstand about what you do? What is some of the things that you might want to clarify? So, what are misunderstandings about your job or what you do?
I think the best interest of the child. They thought, some of them, they thought that we know enough the best interest of our children. And we know that they are not. And we know that we are looking and we are know more about the child best interest for that child more than parents because we're looking from out of the box, you know.
Mm,
So yeah, I think that is.
okay. Is there something you think the public should know about this job, or that they don't? That's it. Okay, that's important for them to know that they don't know.
For what?
Is there anything that you think the public or parents should know about what you do or your job that they don't know? You think it might be helpful that they knew?
Um, Maybe it's connected with the before answer that we are just want the welfare of the child. We are just want to give the children the well-being, and yeah, it's connected with the previous answer. Yeah,
Okay. So it's that your focus is, or what you want, you're saying, is always for the best of the child, welfare of the child.
first.
Oh,
Yeah.
okay. And is there anything else that you want to share, or you want to say that you haven't said, or are there maybe questions that I didn't ask you that you thought I was
Yeah.
going to ask?
Yeah. Um, I think the child protection policies or the child protection intervention, it's it will be different from country to another country. It will be different, even if we are all in the same country, but it will be different from family to another, from uh, uh, like from like from situation to another. Like sometimes I, as Rahma, I can understand that I cannot give my child junk food, right? Like yeah, if he's like under 5 years old.
mm,
Other parents, they see like, I can give him that junk food. So when we refer that two cases to the child protection or to the social worker, they see that that child, he are facing neglect, and
mm,
that child, the mother, she's taking care of that of her son. But when we are doing our case study, we see that the mother who's giving the junk food for her son, she's working. She's a single mom. She's living alone. She don't have the time to cook for her child. And the other mother who's who's giving the healthy food for her son, she's free. She's sitting in her home. She has a husband who bring the money. She has a nanny who take care of the child. So, like, not all cases we can deal with it the same, you know.
mm,
And I'm always like to understand the case from the parents or from the caregiver, because judge before I do the judgment on the case, and before I take the, especially happens when I was working previously with the INGOs. Like some actions we took it, and after we took it, we were thinking, I am right, or am I right or not? Did I do the right thing or no?
mm,
What if the parents like have another scenario or another situation? What if the parents, they need sometimes? What if the parents, they need support more than the child, you know?
mm.
Alhamdulillah, here it did not happen before. Um, but yeah, it's happened with me when I was working previously with the INGOs. So yeah.
Okay. Okay. What advice or what would you suggest if someone is young now and is watching this and wants to do this job? What advice would you give them?
Listen, listen by your heart before you do any action. Listen by your heart and see that child inside everyone you're dealing with, because also the adults, they have a small child inside them who can sometimes control their actions and reflections.
Okay. So those are wise words. So listen.
Yeah, listen.
Okay. Thank you very much for sharing your story. And staying, I know it's later where you are, so staying up late to talk to me.
That's- Thank you so much. It was a very useful interview, and hope to to talk more about it.
Okay.